So looking at the medial side of the rear foot and ankle, what you want to do is look for the landmarks that are easiest to find. The first one on the medial side that you can find that's easy is the medial malleolus. And you can determine the position of that by tapping on it, and you'll find the tip of the medial malleolus dives away. And then to be sure about that, you can move the foot through ankle joint, dorsiflexion and plantar flexion. And where there's no movement, you know that that's got to be tibia. Where there is movement, that's got to be the joint. So that establishes the first point of the joint there. And you can work that across to the other side anteriorly, which will give you the margin in this area. The same thing will happen if you go posteriorly. And then by extrapolating out, this will give you the shape of the medial malleolus that runs around on this side. The next easiest to find landmark is the tuberosity of the navicular. And the way I like to find that is to actually place your thumb just distal to the medial malleolus, because that's where the head of the talus lives, and the bulge that's in front of that has got to be the navicular. And you can see it just distal to my thumb there. And you can palpate that, feel the margin of it, and then mark that out as well, which will be something like this. The navicular is quite higher than you expect it to be, which will come out in a minute when we finish this. If you then go forward from there, if you're on the medial side of the foot, just to establish all the landmarks, you do a similar thing with the first metatarsal head. Find out where there's movement, no movement. Where there's movement, it's got to be the base of the proximal phalanx, and then just proximal to that will be where the head is, and you can put a mark there. And it's a similar process that you did just with the medial malleolus as well. And this will give you the position of the first metatarsal along this line. And then really you've got to extrapolate from here to here. So to find the first metatarsal cuneiform joint, medial cuneiform joint, you can do the same thing by moving the metatarsal up and down. And where you don't feel movement, it's got to be metatarsal. Where there is movement, it's got to be the joint line, and that's right up here. Okay, so that's got to be the first cuneiform joint. And I can feel that the first metatarsal shaft dives up really quite high, because the abductor hallucis is sitting here. And so the shaft is up in this area here. So it's going to go up something like this. And then we can feel the bottom of the first metatarsal cuneiform joint, just like you feel the top. It's the same technique, especially with a nice bony foot like this one. It's easier to find. And then we can go up like this, and this gives us our first metatarsal, which is probably fairly accurate. And from there you can extrapolate all the way forward. So we know that the talar head, if we come back to this again, it's on this side. So it's got to be something like this. And it has to be close to or just in front of the medial malleolus. So the talus should be like that, which means that the navicular has to reflect in front of it. And the navicular has to dive upwards towards the medial cuneiform. And again, with this foot, it's pretty easy to feel where the joint is. And it ends about here. So the navicular is a lot wider than you think it is. And then you can extrapolate that the first metatarsal, medial cuneiform, first metatarsal joint is going to be in this area here. And then the navicular will dive across right over here laterally, which we'll look at in a minute. But this now gives you the medial side of the foot. And then from there, you can look at structures like nerves, artery, vein, and we'll come back to that in a minute.